at birth, because stereotypically we only generally think about sex assigned at birth, but there's a lot of different parts of a person's identity. So gender identity is, the gender that we identify as, who we think our gender is. And before, when we used to think about gender, it used to be in this like bidirectional arrow, which is like one arrow and an arrow on one side and an arrow on another side. And we used to think, okay, one way you go on the arrow, you're more of a girl. One way on the other arrow is more of a boy. We've moved away from that bidirectional arrow because we have found, really youth have taught us that gender identity is very complex, meaning that there's a lot of different identities. And with that bidirectional arrow, it feels like for a youth or an adult or anybody to be more of a girl, they have to sacrifice being a boy to move in that direction. And so now we've moved more to a schematic where it shows that anybody can have parts of them that feel more like a girl, a boy, other gender, just to be more inclusive, especially people who are, for example, non-binary. And then gender expression. So a lot of people don't know what gender expression is, like that phrase, but actually we're all very quite familiar with gender expression. And that's how we express our gender to other people. And that could be our name, our pronouns. For example, people who are more feminine want to potentially wear their hair longer. People more masculine want to wear shorts, pants, and wear shorter hair. Sex assigned at birth is based off of, for the most part, is based off of what we call external genitalia, body parts that are in our underwear. But it's also based off of chromosomes too. And actually there's a lot of people say like there's only two genders, or there's only two sex assigned at birth, but actually that's a really big misconception. There's actually diversity within sex assigned at birth. So there are people, because of just variety, that have genitalia that is not purely female, not purely male. They're born this way. In terms of chromosomes, we've always learned in biology that there's XX and XY, but there's actually many people who were born with extra sex chromosomes, less sex chromosomes, for example, XXY, Y, just Y. So there's actually a lot of diversity, not just in gender identity, but sex assigned at birth. So it's usually assigned female at birth, assigned male at birth, and intersex. And so intersex is all the kind of other differences that I talked about. And then there's people who are physically attracted to and emotionally attracted to. And again, not having that bidirectional arrow, because there are some people who are attracted to both men and women, attracted to other genders. And so there's a lot of different parts of a person's identity. And I usually give this talk to medical trainees. So these are tips that I give to medical trainees, but I think these are good tips for everybody. But really, the big message that I would like to give is not everything lines up. So everybody, for the most part, comes from what we call a cisgender heterosexual kind of view, where we assume people, because somebody who is assigned female at birth is going to identify as a girl and they're going to like boys. We kind of assume that about people, but really there's a lot of variety, which is what makes me happy, but there's a lot of variety. And so it doesn't all line up. The other second tip is all of this can be fluid. So a huge difference between youth and adults is that for youth, this is a time, especially during adolescence, when there's a lot of exploration, which you all probably are very aware of, having your own kids, but there's a lot of exploration around this time. So there's not only fluid identities. For example, for a gender identity, there's literally a gender identity that's called gender fluid, where for somebody's identity, they can identify more as female or feminine on certain days and more masculine or as male as other days, or more attracted to girls on some days and more attracted to boys on another day. But there's also just inherent fluidity with time as youth are exploring themselves and who they're attracted to. And also because you may or may not be aware of this, but you probably are, there's a lot of stigma against people who are not cisgender and people who are not straight. And so for many youth, because they're not fitting into the box that society expects them to fit in, there's a lot of hesitancy for a lot of youth. And so there's a lot of fluidity in that way, and that maybe they do feel that they're trans, but they don't feel comfortable about having that identity, or they're scared to have that identity. And so they're not yet ready yet to transition or identify concretely as that gender identity. So there's a lot of fluidity, particularly with youth and adolescence. And this is something that I tell medical trainees, but again, I think it really helps for parents, for teachers, for anybody, is that if there's ambiguity, then you can always ask a youth. Like, for example, I tell teachers that if a youth tells you that they're non-binary and you don't know what that means, you could always potentially ask if you feel comfortable. But I also tell people that you should really only ask, and that includes your child too, only if it's pertinent to their care, or in this case, to their safety or to the trust that you have with your child. I tell particularly medical trainees that just because there's different parts of a person's identity, it doesn't mean that you are entitled to knowing all of the parts of a person's identity, because it's really up to the youth to determine whether they feel comfortable telling you, primarily medical trainees, but also parents and educators too, and following their journey and their comfort level, and for them being able to describe to an adult the different parts of their identity. So this is just to kind of ground us and use terms that are generally more up to date. But I'm also happy to talk more about terms. I'm really here to talk about whatever you all want to talk about. And I forgot to say this at the beginning, but I always tell people that a huge disclaimer that I have whenever I do any of these talks is that, so I myself, I identify as a cisgender straight woman. And I have a 2-year-old. I don't have any kids who that I know yet are trans or LGBTQ plus. And so I don't have any lived experience of being LGBTQ plus, and I don't have any personal experience of having a child who's LGBTQ plus. But I do have a lot of experience of providing care for teenagers who identify as LGBTQ plus, and also providing medical education for trainees. That includes medical trainees, dentists, research students, on just how to be as inclusive as possible when working with adolescents. So yeah, that is my slide that I have for you all. And I'm happy to really answer any questions or go over anything you all want to talk about.
Dr. Pham, I just want to jump in. I love that slide. I think it really spells out for a lot of people that don't fully understand whether they have life experience or not with the LGBTQ plus community. I think it's a great simple slide to kind of break it down in real life. So I really appreciate you sharing that with us. And I think it's interesting, some of the training that you do to the medical trainees in a variety of different fields. I wonder if you could speak a little bit to, educators are faced with a lot of different things in today's world than they've ever faced before, from, intruder drills to all kinds of different what they got into education for probably wasn't a part of the plan. And so I wonder if there's just some simple, maybe look at a middle school to high school educator. And what are some simple things you would suggest from your side of things, of seeing different patients that have come in, especially protecting their mental health of the entire classroom, of someone who is maybe questioning their gender identity, their gender expression, who they're attracted to. What are some real simple things you can do to lay out in the classroom that all feel a little bit safe? And I also think being respected is a real important piece to the mental health of the LGBTQ plus community.
Yeah, I think in general, what you can do for entire classes is just be open-minded, and representation is really important. And for a lot of our youth, a big part of them not wanting to come out or not feel safe coming out is there's just not a lot of representation of gender diverse people. And I know that this is controversial with things that are going on in Virginia and outside of Virginia with books with trans youth, but actually that is what makes our patients and youth feel more comfortable, when they see more representation in books and education materials. And for example, when I have patients who go to schools that ask about gender identity and pronouns, they're honestly mind blown, because they're not expecting that. And or even just having and I know this is also controversial, but even having stickers of flags, or a rainbow flag, or talking about Pride Month And that so students know that even though they don't have to out themselves to their teachers or talk to their teachers not expecting them to like spill everything about themselves, that they know that their teachers are there if they need them, and they don't have to worry about if they did want to use a different pronoun that they could potentially do that. And so I think in general that would be helpful. And then on an individual level, I think really just listening and being curious, but not being nosy, I think is really important. A lot of people, I've had patients where like, a youth is just what we call gender nonconforming, which means, for example, we have cisgendered girls who just, they're not into like dresses. And that's obviously totally acceptable, but especially now because of the change in political climate and also visibility, people are like, oh, she must be trans. And so they like ask a bunch of questions, very intrusive questions, when they're like, nah, I'm a girl that likes like stereotypical boy things. Mm-hmm. And so I think not making assumptions, but just being open-minded is very helpful, because I think sometimes adults push. And if a youth is not ready, she may be cis, or maybe she's trans and questioning. If a youth's not ready to talk about it, by pushing them into talking about it is probably going to make things worse. So on an individual level, I would say to be curious, but not to be nosy, and to be open-minded.
I love that curiosity piece. And I think if I'm hearing you correctly, that listening is a big part of taking care of not only the child's mental health, but perhaps maybe your own, because as a parent, a caregiver, maybe a teacher, a school nurse, when a child comes to you with something that maybe you're not as educated on, or that you perhaps have your own bias or whatever it is, but you have this child in front of you, I think giving you that opportunity as the adult to take a pause and take a moment and remember that you don't have to have an answer, that sometimes the best gift is listening. And so what are some questions? So let's like put out a scenario there, and a child comes to their teacher and they say, let's say it's a girl, and she's like, I'm really questioning. I find myself that I don't fully understand what's happening in me, but I find that I might be identifying more as a male, and I am scared to go talk to my parents about it. Can you help me with that conversation? Or, I don't know what to do. I'm just feeling really worked up. What are some just real safe questions and guidance that either it's teacher, school nurse, or caregiver in their life could ask to help guide them down the right path?
Yeah, I think the questions are very similar to questions that adults, caregivers, and teachers would ask in other ways. But I think people forget that it's just the same thing, but this just seems like a more sensitive topic. But it's, can you tell me more? And what can I do to support you? And that's really just following. And then we do that in our clinic as well. Like, for example, I provide gender affirming care for trans youth. And I never tell patients like, you should be on hormones. It's, what do you want? And what can we as a group, how can we as a group support you in a safe way? And I think that goes a long way, because oftentimes what I see with parents and caregivers, they're like, well, what is your gender? Do you think you're a girl? Do you think you're a boy? And again, I think that's really not fair, because that's not what they're asking for. They're not asking to label themselves. If anything, that's probably all they're thinking about. Mm-hmm. And so I think just being able to see like, well, how can I help you? Maybe it's therapeutic listening. Maybe it's resources. Maybe, it's not talking about it, but just acknowledging it and knowing that that's maybe why they're grumpy in class today, And so I think just meeting the youth where they're at. I joke with medical trainees all the time that if a patient tells you that they're gay or they're trans, like, it doesn't mean you go in with like flags and stickers and red, because they may not be there yet. And that's very sweet of you to think to do that. But a lot of you are just like, no, like, I'm not there yet. Like, I don't want to be a part of that. And that's totally fine. And so I think it really is just, tell me more. If you feel comfortable, tell me more. And what do you need from me now to support you? Do you want me to check in with you about this in a week? Like, it's the same thing that we do for other topics. Yeah.
That's great. And I think that's an important thing to share, because sometimes we, like, of course, as parents, we want to have all the answers. And, even if we're confused or don't understand exactly what's going on with our children, which is really real life, we don't normally understand
Yes,
outside
exactly.
of any of this. Trying to understand an adolescent is, we bring our own baggage of our adolescence into all of it, but we all do it out of love. And I think sometimes we could be overly supportive.
Yeah.
And I will share with you and the audience that I am the mother of a transgender male. And I was speaking with him recently about this conversation. And I said, if there was something out there that and it not just with people dealing with transition or just anything, what would you, from your perspective, want caregivers out there to know? Like, what would be important from, walking in your shoes and from your eyes that would be really important? And he said, I want them to know that anyone going through questioning and confusion and their own fears, their own, perhaps homophobias that they have, that they're not expecting us to understand it all. And that this is not only, once you kind of get through those emotions, that it's not just an opportunity. Let's say it is a transgender and someone going through transition, that you as the caregiver have an opportunity to transition as well. And you have an opportunity to grow and learn more about yourself and how you express yourself in a variety of different ways. And so that it could be a real gift in a really hard situation that in many people's lives. And it's not just with the caregivers, it's an opportunity for educators to grow, for coaches to grow, for, your neighbor to grow. So I thought that was important to put out there. And the second thing he said is that no one is expecting the adults in their life to get it all right.
Mm-hmm.
Especially if you grow up in a household with, two heterosexual parents, that what we would identify as normal, life, that that you don't have to have it all right. And that if you just admit that you may make some mistakes along the way, that helps their own anxiety and panic that builds inside themselves. So I think that's just a second point. I know that as a mother, you have expectations for what you think your child's life is going to look like. And you have to go through all of those stages of, oh, wow, this isn't going the way we had envisioned, not even planned, but just envisioned. And you have to be careful of not letting your fears spill over to your child who already has all those fears. So, if I had walked into your office with Tyler at 17, and you had your meeting with us, and I pulled you aside and I was like, can you just talk to me for a second? Because I'm so afraid every time he goes into the male bathroom. I'm so afraid of what's going to happen to him. Like, I can't breathe. How do I model something for my child that is true and authentic, but also keeps us both in a good mental balance? What would you have said to me at that point?
I mean, I would first tell you to give yourself grace. I think it is interesting because I find, despite what a lot of people say in the news and things like that, I find the parents of my LGBTQ patients to be the strongest advocates I've ever met. And just like when I cluster kind of families together. But it's a journey, and it's hard to just kind of be ready and know exactly what to do because there's no parent guidebook on this. And just like you said, I think that all parents, for the most part, want their child to be safe and happy. And I think realistically, it's really difficult knowing that you want your child to be happy and safe when they have an identity that is really marginalized in this country.
Mm-hmm.
And nobody teaches you how to do that, And I think that first, to just give yourself grace and to listen to your child and also to talk to other parents who also have gender diverse or lesbian, gay, bisexual, queer plus children themselves, because they've been through it. And of course, your journey is not going to be the same as theirs. But I think that can be very helpful to find allies for you and your child, and know that you are doing your absolute best in the context of a kind of awful world that we're living in right now. And I always tell parents, like, you should put the blame on other people because you are trying your hardest, and it's really not fair that you have to have these fears for your child. You have the normal fears of your child not wanting them to break their leg, and
Right.
and like becoming an independent, mature adult who can fend for themselves. And now you have to add on that they have to, we all know the realistic things that are going on. And so I think giving yourself grace and knowing that whatever you're doing, you are trying the best. You may make mistakes, but we make mistakes in parenting all the time. I have a very picky child, and I feel like I'm constantly making the wrong decision about how to feed my child and how to make him not a really mean child. And and so I think these are the same things we have to do, but expect, like, compounded by so many other things. And so I think giving yourself grace, talking to other parents to really vent and know that you're not the only one, and to know that you're not being a bad parent, as long as you're trying and you're listening to your child.
Right. And and I think it's a great opportunity to learn more and educate yourself. We live in a diverse world.
Yeah.
And we're not cookie cutters. And so and I also think that we should look a little bit at, I'm a different person at my age than I was at 30 and what it was at 20 and 15, right? So I think sometimes we jump to, well, what do you identify as, and who are you attracted to, and what, and you put yourself there, and if you have to stay there. And I think in general, we forget that in your gender, sexuality, your expression, all of that, it's kind of natural for it to be fluid. You don't know who you are at many different stages in your life. And so maybe letting our children know that this moment in time, I hear you. This is what you feel. Now, there's not always, I think, situations that is true in. I think, like you said, you look at everything individually, but I think it's a good reminder for us as parents to take that pause, take that breath, and then just understand that they're ever evolving humans just like we are. I would love to switch gears just in the same concept of, the neighbor, right? The parent who is the neighbor of the child, who, their child gets off the bus and says, Sally now goes by him and is being called Stephen, and runs off and plays, and they're not thinking anything else about it. And then the mother or the father or the grandmother, whoever's there, and like, well, what does this even mean? And wants to bring it up at dinner, or doesn't all of a sudden know how to talk to their neighbor anymore because they feel like, oh, what's going on? What's some tools you can give that neighbor that would be supportive? Because I'm hoping that a lot of people on this webinar right now don't have anybody in their life that is LGBTQ plus. I'm hoping that they're just wanting to learn more because this is the world we live in, and they want it to be a more inclusive world. So what are some skills there?
I think it really depends on your comfort level as a parent or a caregiver or somebody else, because there is a lot of burnout and burden on LGBTQ plus people and their loved ones on teaching other people about gender, about sexuality. And although I think that is very important, that's very tiring. It can become very tiring for people, and it's going to persist throughout their life. Like, the reason why I do so much medical education training, because my patients are honestly exhausted going to their primary care provider or their cardiologist and having to explain themselves. And like, it's just very tiring. And so I would say it's up to you and your bandwidth. Sometimes if you feel like you can provide that education, you go for it, and it should come from parents. I will say that, as opposed to the youth, because they're going to be dealing with this entire life. And the way that you do it, depending on their age, will be very helpful skills for them as they adults. Because, like I have 17-year-olds who still don't feel very comfortable talking to a doctor, period, because of this. And one of the main reasons is because they don't want to have to explain the whole thing. And I find that when they see their parent doing it, when they're at a comfortable age and it's being modeled, they can see how you're doing it. Obviously, at very young ages, that's probably inappropriate because that's very stressful for a person. But I find it's totally up to the parent, and you should never feel guilty about your decision in that moment or your general feeling of how you approach other people. But I would say always preserve yourself and your child. And if that means, like I can't and I don't have the bandwidth to explain it to my neighbor right now when they clearly don't get it, or maybe they do and they're curious. Like if you don't feel like it, don't feel guilty, because it's not your job also to like change the world.
Yes.
It really is my job and other people's job to change the world, to make people more aware. But I will say that having those conversations and practicing those conversations with people you feel comfortable with, like literally, I will tell some parents, like, do it in a mirror or to your partner or somebody, because unfortunately, as a parent, you probably already know this. It kind of ends up being a script. You just kind of like, what to say. It takes practice, but I will say that it is very helpful to do it in front of your child when it becomes developmentally appropriate, because they're going to have to do it by themselves and they're going to have to advocate for themselves. And because our parents are such great advocates, it's such a great skill for our patients to see, our youth to see that in action, so that they can do it. They can have the confidence, and then they're going to get their spiel when it comes to dating, when it comes to seeing a provider, a teacher. And that's the hope, right? That we bring those skills. I know that you were talking about skills to other people, but actually I think it varies. And it can be from a small conversation to and it depends on the person's willingness, because there are plenty of resources out there if they're willing and they want to look them up. And, I literally have some parents who have handouts and they're like, I don't want to talk about this, but if you want a handout, here you go. And that's why having inclusive educators is really helpful, because it's part of their curriculum. It's part of how they work with youth. And so parents of cis and straight youth are also getting this education and also getting these resources. So that was very long-winded and fully.
No, it's perfect. And I actually I love it, because you gave me permission to be able to say, I've been kind of through this journey for many years now, but it gives me permission, and I hope it gives some other people out there permission, to just be like, I don't have to do this right now. Like, I love my child. I'm proud of my child. I am supporting my child. I've had a long day at work. I'm just tired. And my child is more than this too. This is a big part of their life, but they are, we don't have to always just be talking about this.
Totally.
So I really appreciate that answer. And I think it was exactly what I needed to hear tonight. So thank you.
Yes. No, that is totally right. Sorry, just to go there. I tell people all the time that for my patients who are LGBTQ+, there's something, I'm sure if I did a study, nobody would pay for the study, but there is just this level of creativity among my LGBTQ patients that is unmatched. I feel like all of my patients know how to play at least one instrument or love musicals, but nobody talks about that. When they're just your normal human beings that like to do things like everybody else. And so that's why talking about those things, my child likes this. What is your child like? And then when they find out your child is gay or trans, okay, great. My child is just like your child, but they have a different gender identity.
And at the same time, my child, being an adolescent, is going to make mistakes that have nothing to do with their gender identity. It's just an adolescent mind who doesn't have a full frontal lobe. Know? So that's, that's why it's so important, so that we even let our children know, and teachers and everyone know, that you're all the parts. And you still are who you are inside. And so I think that is just super, super important to remember in this world. I think as caregivers, it would be important to remember. And, I'm a big, just take a second, pause kind of person. Sometimes I wonder if it's because I have a little bit of slow processing and I have to wait for a second before I can respond to a situation. But I have found in this environment and the climate that we're in general, across the board, about very reactive, angry things in the news happening. Our world's just like kind of like technique all the time, right? And it's easy to get caught up in that, and especially when you have maybe somebody in your life that is marginalized, and you hear something and you see something, and you just are like, ah. And how we model behavior with our children, with what they specifically might be going through, is super important, and how they take care of their mental health.
Yes.
So would you give some tips to us as caregivers on when we're feeling really worked up about something either we saw in the news or something we saw in the park, or life happening, like that developmentally for a 12 to 17-year-old kind of age group? If you're trying to model, like, this does make me angry, I'm not pushing it down, but this is how I'm responding to my anger. Like, that's just a basic life skill that has nothing to do with LGBTQ+. It's just when you have that, maybe us as parents, we become a little bit more reactive in the moment.
Totally.
So do you have any skills there that you wanted to share with us?
So I think that's a great question. And that's actually a research project that I did. During it was about 3 years ago, I did a research project where it's called a qualitative study, which means it's not like numbers. You ask a bunch of participants and then you take their quotes and then you analyze their quotes. And one of my research question that I had was, there are so many stories, negative stories about trans youth right now. How is it affecting trans youth? Because I think as adults, it's very easy to think like, oh, well, my child doesn't watch MSNBC or Fox News or like CNN. And so maybe they're like in this little bubble. And we found, not surprisingly, as you probably all know, having kids, is that they're very much consuming news stories. Because the difference between me, and I'm going to just make assumptions about the people on this call, versus teenagers now, is that, like, for me, when I was little, to consume the news, I really either had to read the newspaper or watch TV. But now, because of Instagram and Facebook and algorithms, it is very easy to consume news stories. And so I just wanted to say, do not assume that your child is not consuming news stories, either by word of mouth, but really social media. If they're on Instagram or Facebook, and if they have clicked on anything that has to do with LGBTQ+, they're going to see these stories in their news feed. And the research that we've done shows that it is definitely impacting their mental health, as it obviously is going to. When you see people targeting people who are your identity, whether sexuality or gender identity, it's really hard to not internalize that. And the research that we did showed that it really is causing concerns for safety. It makes youth feel not safe, not fitting that cisgender heterosexual like box that people expect them to be in. So I would say, know that if you're consuming these news stories, your child is very likely. I would just assume. And so I would, depending on your trust and relationship with your child, I personally do recommend talking about it with your child. Like, did you see that news story? If you didn't, do you want to talk about it? Because you probably are going to. And then if they feel comfortable talking about it, I would ask, how does that affect you? And I find that, as opposed to responding to the news story and being upset, which is very normal, I often find that when adults are talking to their children, they automatically tamper their reaction a little bit because of their child, and thinking about how their child is going to respond. So if you do have a big reaction, try to do it separately, and then bring it up if you feel comfortable, that news story or theme of news, like, for example, during a legislative session, being like, there are a lot of bills that are being introduced, and, based off their age, if they're like 7, they may not know what a bill is. You know what I mean? And then say, like, have you heard about it? What are your thoughts? Because I think that having a conversation, you're automatically going to bring it down a little bit, which I think is helpful for the youth. But to not sugarcoat it, like, for them to know that it is upsetting and why it is upsetting, because you also don't want them to grow up very sheltered, when there's so many stories that are very real and going on, and that's going to help them, and I think yourself, process the news.
Mhm.
This is my personal kind of recommendation. There's no research on the actual best ways to go about social media. Like there literally is no research that says like limit social media to 2 hours and that'll help mental health. We don't have that yet. And actually, there actually have been studies and it didn't support that for obvious reasons. It makes youth also very anxious to be away from social media. So it
Right.
kind of like counteracts. But for me, I think that's personally a recommendation that I have.
I think it also goes back to some just basic mental health awareness of like when something is happening, good or bad, when you're happy, you feel butterflies in your stomach, or, when you're excited. But those butterflies can also be when you're nervous. And I think sometimes as adults, we can be very aware of how our body is feeling at that moment, whether it's during our social media scrolling, whether it's during reading an article or listening to the news, that being, one of the first steps for me personally, to de-escalate my spinning thought is to be like, wait a minute, how does my body feel right now?
Mm-hmm.
And it kind of gets you out of that place, and you start to have in a world that we feel like we don't have a lot of control, you start to control certain things within yourselves. And that's just, basic, your relationship to stress in life, that I think that is applicable to everything that's happening in our daily lives.
Yeah.
And if you don't mind, could we go back a little bit to the younger ages that you see? And I think a lot of parents have a hard time understanding the true medical, like what's happening in their bodies when you are blocking puberty, when different things like that. I think that's a real difficult time, even for the most supportive parents, understanding like what's the long-term effects, what's happening now, what do I expect? If you look at a normal person going through puberty, you're going to expect the mood swings and the this and the that. But when you have a different situation you're not used to, can you walk through that whole medical side of things, that how you would talk to a parent and that are maybe fearful?
Yeah, I'll give a pretty like brief, like a general overview. So despite what many people think, we don't do any intervention before puberty. So that's just like I would like to make sure that people are aware of that, because oftentimes also parents will come to us and be like, it's too late. My child came out at a later age when they're still like 11, and like it's too late and I feel like I missed the mark. But really there's nothing medically to do until somebody's entered puberty, which I'll go into. Before that, like for example, my gender clinic, I have seen patients as young as 4. I don't do anything medically, but basically I kind of honestly, a lot of the questions that you're having now, the questions you have, I talk about with parents and get them plugged in with groups of people that can support them, because it's a lot of like social transition and like, for example, conversations about like, what are we going to do when your child has their first sleepover? Like, are you going to tell the parent? Should the parent know? We have a lot of those kinds of conversations. But really, there's no medical interventions that you can do before starting puberty. And the age of puberty varies. It varies drastically from person to person. But in general, for people who are assigned female at birth, so people who are capable of having periods, their puberty can start generally as young as 9 to 10. And then for people who are assigned male at birth, it's kind of like a year after. So 10, 11, 12. And but even when somebody has entered puberty, it's still not too late. You haven't like messed up as a parent. At any point you can do anything, like medical intervention, like it's never too late is basically for the most part. But puberty blockers are really just a pause. They don't cause any changes. They just pause changes. So for example, if somebody has started puberty and there's still more puberty to be done, for example, if they're assigned male at birth, they still have more voice deepening. They still have the capability of facial hair that hasn't happened yet. You start a puberty blocker and it just pauses you, and that's it. It doesn't cause any changes. You would need hormones for that. Same thing for people who assign female at birth. If they still have more chest or breast growth to have, you can put a pause on that and prevent that from happening. And what I tell parents is the benefit is not that your body's going to change. The main benefit of puberty blockers is now your 11, 12-year-olds can worry about like making friends and completing their homework and not worrying about their body developing more in ways that they don't want to. And also it gives the youth time to think more about what their gender identity looks like or what they would want. I would say most youth already know, but it still feels nice for their parents knowing that it also gives the family more time to think about what their gender identity and goals look like for in the future. But really the risks are very minimal. They focus on risks, but they're not really that bad. But the main risks are it can decrease your bone strength, but that gets better once you press play again. Either you press play by taking the puberty blockers off or you add hormones. And it affects your fertility, but it only affects your fertility when you're on puberty blockers. So for an 11-year-old, that's usually not an issue.
Right.
But their fertility, it's a little bit more complicated with the fertility, and I can answer this question. But basically, it's just put a pause on everything.
Okay.
But eventually, you either have to press play and the puberty of their sex assigned at birth develops, or you add in hormones.
And is there any, and Sarah, I think we have a question, but is there any, just wanted to follow up, is there any, what to expect? Let's say you stop taking the puberty blockers, you're not quite ready to do hormones, would it be a rush of puberty, or would it just naturally start the flow?
It depends on where it depends on where you were in puberty. Mm-hmm. So if you started off earlier in puberty and you press play, then it's going to be a slow process. But if you started at puberty blockers at like age 14, you've done a lot of your puberty. And so if you press play, you would have more of like a rush back of the hormones that your body naturally creates. Right. So it all depends on how far along in puberty you were when you started puberty blockers.
That was very informative. Thank you. I think it took a lot of fear out for a lot of parents. Sarah, what was our question we had come through?
Yes. So someone asked, are the blockers and any other medical intervention, are they done in tandem with a behavioral health provider as well?
That's a very good question. It honestly depends on the provider, the clinic. Every clinic and provider practices differently across the United States. But for me, for example, I do not require a mental health provider as long as there's no concerns from the parents. This is very, 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 very rare. But for example, if a child had like bipolar and was not seeing a therapist, then that would be different. But for most of my patients, they've already established care with a therapist. It's pretty rare for my patients who have never seen a therapist before. And so I work in tandem with their therapist. So basically I ask the family to contact the therapist and the therapist contacts us. And then for here at Children's Hospital of Richmond, we have a psychiatrist who does mental health assessments prior to hormones. And that's actually new. So everybody's different. There are some that don't require it. There are some that do require it. But for the most part, we all try to work as a team with the therapist just to be as thoughtful as possible. For example, if a patient has autism, what can we do to best work with the youth and thinking about their goals, given, if they have autism and they think about things a little bit differently.
Mm-hmm. That's a great question. Sarah, did you have another question?
I think that was the only one from our Q&A right now. But I was going to ask if you could talk just a little bit about, so we've talked about, proactive approaches, and say your teen has come out to you or your youth, and they're totally comfortable talking to you as their caregiver, right, about their gender identity. But you notice that when it comes to going to school, they are really anxious, or you've seen changes in their mood when it comes to hanging out with friends or being on their sports team. What are things that caregivers can do in those situations, maybe proactively in their home, but then also if they do need to seek, support outside of their home as well?
Yeah, so there's going to be a theme in my answers, but it totally depends on the youth. Mm-hmm. And that I would say that is the majority, is that for youth who have supportive parents, they feel differently when they're at school, which makes sense because they haven't met other people, they're not out yet, or all of my patients, so every time I meet a patient, I always ask about school environment, safety, and bullying. And I would say a vast majority of my patients, even though they're not bullied by an individual and don't lack safety, they hear rhetoric that's very homophobic, anti-trans, not necessarily geared towards them, especially if they're not out, but just hearing that, it's going to make you not want to be out at school. And so I think it really depends on the youth. You know, if it feels more safe for them to not be out at school, then we just have to figure that out and figure out what ways that we can keep them safe. And for some of my patients, if it's, you know, bathrooms, then the parent can advocate for the bathroom. It really depends on the youth and what they need in the moment. And that's probably going to change. And it really varies. For example, for my trans feminine patients, there is so out of all of gender identities, that's where the most stigma is against trans femme people. And I would say because of that, a majority of my patients will actually start hormones before they socially transition, because there's a safety concern that if they don't look feminine but use feminine pronouns, that there's a safety concern that people are going to think that they're just a boy trying to go into the girls' bathroom. And so I that's why I would never urge somebody to like be out at school, or like it totally is up to the safety of the youth and whatever makes them feel safe, and the parent just figuring out what they need in the moment and kind of keeping up to date with that, because that may change.
That's so great, because I think giving our youth a sense of what they can control and ownership, even if they don't like the fact that it's not an open environment, their safety is number one. And I think having that be at their power, right, is so good for their mental health. And I love what I was reading up on the Trevor Project, and I love how you know, one of the biggest preventers of people in the LGBTQ plus community of contemplating taking their life is simple respect.
Yeah.
Just simple respect, just using by their preferred pronouns. And I think that's something so easily we can all do, even when we don't understand, because that's a human being walking on this earth that deserves to be here. So I think that simple skill of knowing just basic respect is powerful.
Totally. And that's why if parents want to, and if their child wants to advocate for things like the school using the correct name, I tell them there's research that's out there that, and I will show you the research that you can literally print and bring to the school. Obviously, again, if the child wants that, because I don't want them to be mortified because the parent brings like the study to the school. But there's research out there that shows the benefits of supporting youth, including, like you said, using chosen name and pronouns. There's also research out there that talks about the differences in having supportive parents and unsupportive parents and what that looks like. There's research that's out there. If people are willing and ready for it, go to the Trevor Project, ask people like us at Chore or other people, their therapists, but there are resources that are out there. So it's just kind of what the child is ready for.
Absolutely. So we do have another question for you, Dr. Pham. Do you refer patients for gender affirming clothing? And they said they're specifically interested if you talk with patients and parents about bindings.
Yes, I do. And I actually got a little grant. So if you come to Chore, we have a little box that has garments for people to look at, including tucking underwear, binders, trans tape, for if you do something called open chest binding, where it's not like a binder, it's not like a tank top, it's tape that you use to bind. I also have handouts. But yes, I do, because I feel very strongly that people think that all I should talk about are hormones and puberty blockers, but that's not fair to my patients. I talk about binding safety for people who are assigned female at birth. We talk about ways to stop your period, because maybe that's all they want is a medication to stop their period. And we do that all the time for cisgender females who painful for trans. people who are assigned female at birth, but I talk about mental health. I ask about eating because I know that disordered eating is really common in trans youth. So I do all of that because I think it's really important to look at trans youth in a holistic way and understanding that it's not just hormones and puberty blockers that's going to make a youth's life better. Yes, it can for many people, but there's so many different ways. And that's also why I do medical education, because pediatricians, okay, yeah, maybe you don't feel comfortable doing puberty blockers and hormones, but you should be comfortable talking about how to keep your patient safe with binding, tucking, mental health. But for some reason, people don't feel comfortable doing that. But yeah, I'm on this crusade to try to
I love it.
as
I think it's
possible.
wonderful.
Yeah,
Awesome.
I do. And if you want resources, one of you can always email me. And I can provide assistance with that.
Thank you. Yes, I will get those from you. So that way, when we do share this recording, we can share any resources that were asked about or mentioned tonight as well.
Yeah.
All right. Well, I think we have answered everything in our Q&A. Grace, before we wrap up, did you have anything else that you wanted to cover?
I just want to say thank you for your work, Dr. Pham. Thank you for your heart in that, and just opening all of our minds, even from somebody that has life experience and not knowing. I have my story. I don't have everybody else's story, but to know there's so many options out there, and the unknown is where our fear comes from. And to be able to talk to other parents, resources like you, and so many different options out there, gets rid of the fear, gets down to the facts, and then we can just take better care of our children and ourselves. So thank you so much for your time tonight. And the work you're doing is amazing. And you're taking care of the whole child. And the whole family, really, right?
Well, that's pediatrics, but yes, definitely. Not everybody does it, but yeah, we should be doing it.
Yes. So great. So great. Sarah, and do you want to just wrap it up with how people can get this recording and all that?
Yes. Thank you again, Dr. Pham, for sharing everything that you do with us this evening. And thank you to all of our attendees and to Grace for being with us this evening. We did record our conversation, so we will share it with you all along with any resources mentioned tonight and extra resources just so that you have them. Thank you all for joining us, and we hope that you gathered some tools for your toolbox, and we appreciate you coming to learn and gain this knowledge so that you can be the best support system for the teens in your life. So thank you all. Hope everyone has a wonderful evening. Thank you.
Thank you, Sarah.
Oh, thank you. That was awesome.
That was so good. She's so great. It was awesome.
I know. And we had people on streaming on YouTube too.
Awesome. Great. Are we still live now?
Yes.